Now the Democrats are politicizing the coronavirus. And this is their new hoax. But we did something that's been pretty amazing.
Around the globe, people are adjusting to major life changes, helping to fight the spread of the coronavirus. Many of you probably find yourselves at home and
Ladies and gents and ladies, you are here talking sweet with Sweet Baby J. As always, it's an anonymous situation. We have this young man on the phone. Young man, would you like to share your name?
Hey, what's up, everybody? Yeah, my name is D.
What's that? You went in there. What's your name?
My name is D.
D. Hey, what's up, D? All right. Usually I say big, but, it's strange to call a dude Big D, so I'm going to refrain from that.
I'm going to leave that alone.
There you go, man. There you go. Hey, listen, man, tell me a little bit about yourself. One thing that I do know about you is that you work in the healthcare field. How has that been working out throughout coronavirus and the protests and everything? How's that working out for you these days?
Well, yeah, I do work in the healthcare field. I specifically work in a catheterization lab. I'm actually a traveler, so I'm not on assignment right now because my assignment that I had in New York for about a year, because I kept extending it, roughly about a month ago, about 3 weeks ago. So I'm not on assignment right now.
So you just chilling, living your best life.
Yeah. I needed a break. I was like, I need a break. I need a break from the hospital that I was at. I needed a break everything in general, and, just trying to get stuff situated for myself as well in life in general, too.
So as a traveler,
sorry, go ahead.
As a travel tech, you're able to, once you finish your assignment, you can just take a break from working and everything like that?
Yeah, if you are financially smart with the money that you make, you save more than you spend, you can take as much time as you want. You don't have to, once your typical assignments are 13 weeks, as far as I know, that's the ones I take. They can be shorter, they can be longer, but the typical one is 13 weeks. And so you go into a facility, you interview first and get all that stuff out of the way and do all your paperwork and make sure that all of your medical records are in order, hepatitis and all the shot out. So you go into a facility, the assignment is for 13 weeks, and if they like you and you like them after if you go into an assignment for the 13 weeks and let's say halfway through you like the assignment, you like the facility where you're staying, the area that you're staying and all that good stuff, and you want to keep working, you can keep working in that facility. You keep extending your contract 13 weeks at a time for a year. And then once that year is up or close to that year, you cannot work in that facility anymore for like 3 months. It has to be a 50-mile radius from the front door of that facility.
Wow. Oh, so it's from the front door. So they're really not playing games, huh?
No. So, for example, for me, I was at a facility in the Bronx in New York. If I was to have gotten another assignment or opportunity that I really wanted to take, like, say, in Brooklyn or Jersey, et cetera, I wouldn't have been able to take it because it has to be 50 miles from the facility that I was at.
So their concern is that you're out here interviewing while you were supposed to be working for them.
No, it's not the facility. It's part of the rules and regulations of being a traveler because if you're in a certain area for more than a year, at that point, you're not really, quote unquote, traveling. The part of your pay package that you get is tax free because you are traveling. So, you don't want to get in trouble with all that stuff.
So you out here caking, you out here making that real money, huh?
I'm doing better than I was when I used to work at a facility in Florida. My first job out of school, and so I wasn't really making a whole lot of money in general. So I'm like, yeah. It depends. Nurses and techs, et cetera, or healthcare professionals that work in bigger cities like New York, San Francisco, especially if it's like their second or third facility. Because when you first come out of school, you're going to get peanuts. So I always tell people, when they go to school, make sure that your first facility isn't your dream job, like the dream place that you want to work.
Yeah.
Make sure that your first facility, is just anywhere that'll take you, get your year, 2, 3 years in, and then go to your dream job. Because if you go to your dream facility or somewhere that you really want to work, you're not going to be making the same money in 3 years that you could make if you were to come in on the second or third year with the experience already behind you. You're just not. Those raises are peanuts.
There you go.
And people don't think about that.
Good advice.
So compared to what I was making when I first started, absolutely. But somebody that's been, doing this for 5, 10 years, in like New York, San Francisco, cities, it might not be worth it to you, to travel because it is a lot.
With coronavirus, how did that impact you work in a specialized field? Because everyone says to the healthcare employees, frontline employees, but the thing is that you work in a very specialized type of care. Did that impact while working?
Right. I've kept up with a lot of the headlines and articles and stuff. And there's certain areas in the country that just aren't seeing these same things that cities like New York and San Francisco, Chicago, big cities are seeing, because it's just different. New York, if you think about it, it's such a dense population. Everybody's on top of each other. So
literally.
Yeah, absolutely. And even just dealing with this COVID, you think about things like that. Like, for the first time, I was like, I really wish I was in an assignment where there's like nobody around right now. More like my first assignment was that really small town, and I hated it because there's nobody there. And I was like, I hate it. But I wouldn't have minded being in that area for COVID because there's
Nebraska was looking real good right about now, huh?
No, yeah, open space. But, for me, I actually got sick at the beginning of March.
Did you get COVID?
Well, I got sick with the flu beginning of March. I recovered from the flu, and then I went back to work, and I only worked 2 days the week that I went back because I had actually written into my contract that I was going to take off about a week and a half, and I was going to go out of town, leave the country. And literally the last minute, I canceled the trip because that's when COVID really started hitting, especially in New York and bigger cities in the U.S. in general, but the bigger city in particular.
Yeah.
And I was actually going to go to the Dominican Republic, and it was starting to hit there too. So I actually canceled the trip last minute. I was supposed to leave on a Friday, canceled it. Cut to 2 or 3 days later, I started getting sick, feeling sick again, like just feeling like crap. Long story short, I ended up having I ended up getting COVID. I don't know if I got it at work or if I got it just being around in New York.
How did that feel with COVID? Because thank God I don't know about it, but just everyone, you hear on the news about all the people that died from it, and to speak to somebody that actually had it, how did you feel? How did you know?
Right. I wasn't sure if I had it or not, honestly, because I started feeling sick like that Monday or Tuesday. I started just feeling really low energy, just crappy, fever, taking medicines, drinking lots of fluids and stuff. And my fever wasn't going away, and started around that Tuesday. And like that Sunday afternoon, I was like, okay, this isn't going anywhere. I feel like just crap. I thought I had a sinus infection because I had gotten a sinus infection for the first time when I was in New York last year, because this was the second time I was at this.
Dang, suppose you had COVID twice.
So the symptoms that I had were similar to when I had that really bad sinus infection. So I thought I just had a really bad sinus infection again. But then when the symptoms weren't going away, that's when I started to worry after about almost a week. So I had a really high fever, felt like crap. I had pressure behind my eyes. It hurt to even touch my eyes.
Wow.
I had a little bit of like a dry, itchy throat maybe, but I wasn't really coughing. I didn't have shortness of breath necessarily.
Did you have that loss of taste in your mouth that they always talk about, that loss of taste, achiness? I don't know
if it was more a loss of taste, but a loss of appetite in a way, and then coupled that. I didn't really have taste. I don't know if the taste really left necessarily, but I just didn't have an appetite. For me, I'm a big guy. I eat, so that was.
You're not one to play games with food.
No, I'm a foodie for sure. If it's fried, unfortunately, I'll eat a shoe if you fry it.
I know.
So, top of not really having the appetite, I also didn't have the energy, to be making meals, or going to get, and I didn't feel good. So I'm like, I'm not trying to be out in the world right now. If I have it, I give it to somebody else. So yeah, I did have the loss of appetite. And so cut to Monday, which was almost a week later, I did go to the doctor. I put my mask on and I went to Target before that, stocked up on vitamins and just snacks.
Like so many people were doing, yeah.
Yeah, Mucinex, all that. And so then I went to the doctor, and I was actually there for a really long time, like for hours before I actually went to the back. And I hadn't really eaten. So by the time I went to the back, I was over. I think I might have passed out for like a slight second just from exhaustion and just being so hungry. And so the doctor comes in. Well, the text came in before that, and the nurse, took my temperature and everything. I had a temperature of like 103.
Oh, nice little fever popping off right there.
Yeah, I had it. Mind you, this was like almost a week later that I still had the fever of 103. And this was after, and I didn't take Tylenol that morning specifically because, sometimes when you take Tylenol or some sort of medicine, it goes away for a little bit and you go, but like you don't have a fever, but you really do. So,
yeah, the fever's there to actually fight what's going on in the body. And if you take a Tylenol,
your
it doesn't
infection
help.
that you have. It doesn't help in the long run if you take it, and then you get misdiagnosed because you feel temporarily okay.
Yeah.
So I purposely didn't take the Tylenol that morning. So yeah, I had a high fever, really high, like 103, 103 point something. But the rest of my vitals were fine. Like my saturation, the oxygen levels in my blood were still fine. My heart rate was fine. My blood pressure was fine. It was just those just feeling like crap, the symptoms that I said before. I didn't feel short of breath until I went back to take an X-ray just to make sure. And when they had me put my hands up and hold my breath, I couldn't really do it for that long.
And that's when they really saw. That's when they saw it on the X-ray.
Well, no, yeah. So in the X-ray, when they came back, the X-ray showed pneumonia. Well, first the X-ray didn't show anything because he had read an X-ray from when I was there prior.
Oh, he read the wrong one.
To do routine workup, for my assignment. Yeah. And so I was about to leave, and then he comes get back in, and he's like, I read you the wrong X-ray, and it's the wrong date. This is the one from today. You actually do have pneumonia. So then he's like, I'm gonna put you on 2 antibiotics because I don't one for the sinus infection, which I think you do have. And he said, and then we also don't know if your pneumonia is viral or bacterial. So just in case, I'm gonna give you 2 antibiotics. Take your vitamins and whatever you've been doing. Drink. I bet it was make ginger root tea and stuff.
Caribbean herbs.
And
you've been taking it back to the old school.
For anybody that has, sore throats and stuff, ginger root tea is amazing. You just take your ginger root, chop it up, boil it, make a tea out of it with lemon to cut, because it's a little spicy.
Well, you know something?
To cut through it.
A lot of people really do resort back to, let's say, some type of Caribbean culture in which we think back,
old school.
Roots.
Or Eastern medicine.
Yeah, taking it back to the old school, and then, it helps. Yep. People don't know it, but listen.
I use it in conjunction. There's nothing wrong with using it in conjunction with your other medicine. So yeah, I make my ginger root tea. I'll put some lemon in it and honey in it, raw honey. Anyway, he was like, "You're doing all that. If you feel at any point like your respiratory, like you have trouble breathing, do not hesitate. Go to the ER."
Yeah.
I said, okay.
If you can
so
make
I left
it.
there. Right. So, and if they could see you. So I left there late in the evening when I got my prescriptions, went home, started taking them. This was, again, Monday, late Monday night. So I went home, kept, self-monitoring, self-isolating. I told my roommate, I may have COVID because I have a roommate.
How did your roommate, how did your roommate treat you when you told him you may have COVID? Was everything, smooth?
And honestly, like, I'm still thankful. He didn't really trip out. He was just like, okay, he had been, kind of distancing myself from him. And he wasn't really like a social, really outgoing person. He stayed to himself a lot. So in that sense, it kind of helped. Because he stayed in his room, I stayed in mine. If I heard him go to the kitchen or to the bathroom, I made sure to wait after he was back in his room for me to go out. I try to wipe down all the surfaces I touched. All that.
Because listen,
so if he did get it, he was asymptomatic. Because he didn't show anything.
The reason why I ask that is because your situation is not different from many others in which they have a roommate or a loved one, and they are actually still going through their daily life, but at the same time come in contact with others that they have no choice but to come in contact with, like a roommate. So you have to be very precautious in your movements.
Mm-hmm.
Wow.
One of the doctors that I had worked with the year prior, she was a fellow the year prior, and then became an actual cardiologist. During the, be right before this COVID stuff, she wasn't going home. Thankfully, her landlord had left the city to go quarantine somewhere else and was able to offer her the landlord's place so she could stay at the landlord's place and not have to interact with her family too much.
Wow, it was
crazy.
Cool. Yeah.
So yeah, I'm thankful my roommate didn't overreact, he didn't freak out, thankfully.
Yeah. I'm out here in Florida. Everywhere has had a different impact, and from what I'm hearing in New York, it was crazy.
Listen, I was in Florida. I'm in Atlanta right now. I drove down from New York, and about a week and a half ago, 2 weeks ago, like June the 3rd or 4th. The further south I got, the less and less and less and less masks I saw out in public in general. And that's both for the general public and for employees in any business that I went into, whether it was to get some gas, et cetera, et cetera.
It kills me when I see that.
By the time, listen, I got to Jacksonville Beach, like 2 nights later, there was nobody wearing any goddamn mask.
Well, and that's why Florida's on such an uptake. You say you're in Atlanta right now.
Yeah.
Atlanta's pretty hot with all what's been happening. There was a gentleman that actually got killed out there at a Wendy's. There's been a lot of protests going on. How are you seeing that on the ground?
I haven't really. So when I left New York, the protest was starting to happen everywhere, and New York as well.
Did you go to any protests?
I did not, because I was busy I wanted to go, but I was busy trying to pack everything and, leave New York so I can get to Florida. And the only reason why I didn't, and that's one of the reasons why I didn't go. And I also was like, if I end up getting arrested, I know some people there, but I don't know that many people here.
Yeah, you'd be,
that can come bail me out.
You might become an official inmate.
I did not. Right, for the day or two at least, or depending on how things escalate, it could be worse. But
Yeah.
so, anyways, getting back to the COVID, I started taking the all the antibiotics, the Tylenol, and all the stuff, the Mucinex, all that crap. That Monday night, and then my fever finally broke like that Thursday. So it was literally 10, 11 days later that my fever finally broke, and then I started feeling better. And then I didn't get a call from them until that following Tuesday. So a week after I went to the doctor, a week and a day, they finally called me like late that night and found like, you had COVID or have it. And then we talked about, what I had been doing as far as self-isolation and stuff. And I still felt tired, short of breath, a little bit, especially if I went up and down the stairs. And I lived on like the floor, walker up, no elevator.
Damn.
Yeah.
Do you still feel anything like any cough, sinus?
No. Mm-mm. I feel like I'm okay now. Ever so often, like if I'm going up and down stairs, I'll feel a little bit like a slightly short of breath. But I also think that's also because I'm fat, so I don't know. But so I recovered, and then meanwhile, I know I have to. I'm actually about to start looking into cooking some vegan options.
There you go.
That's another story. So in between that time, like right before I was about to leave, the last 2 days that I worked at the facility, they were starting to implement what they were going to be doing. So what happened is we were no longer doing cascades after that, especially through that week. I think we finished through that week, maybe the following week. And then our recovery area actually turned into a COVID net for ventilated patients.
Yeah,
because our recovery room, I think 6 or 7 of them had doors. So they turned it into a 24-hour
isolation room,
7-day-a-week isolation rooms for 7 or so COVID patients that were, for the most part, intubated and ventilated. Yeah. But I didn't go back right away because I was recovering. So once I recovered, I went back. I was working 7 p.m. to 7:30 a.m. one week.
12.
Then they had me working 7 a.m. to 7:30 p.m. the next week, and then I went back following with the third week back to night. Doing it was crazy. Like one weekend, I left work at 7:30 a.m. Saturday morning, and then had to be back to work 7 p.m. Sunday night.
Wow.
Or something crazy like that.
So
it was
the hours you were pulling were just out of control. Huh?
Yeah. So for me, because I'm not they call it a PCT or something like that. Basically a tech that helps the nurses with temperatures and labs and all that good stuff. That's basically what we had to do instead of being cath lab tech. And so you had to go in and check vitals on the patient.
So you were definitely helping out the nurses and the physicians with patient care.
Yeah. Basically like a nurse's aide,
something different from your regular work role.
Yes. Oh yeah, absolutely. I was like, what in the hell? But the thing that just was hard to get through is that because COVID can be transmitted through air vents, we couldn't have our AC on. It was hot as hell.
Damn.
We had to put on an extra layer of cloth scrub because of having to go into the patient's room.
Your protective
and then when
equipment.
Oh, and on top of that, we had to wear an N95 mask while we were in the unit.
Wow.
For 12 hours, unless you were on break or, went to take a break. Yeah. And then when you actually went into the rooms, you had to, on top of, no AC, wearing your N95 mask for the whole shift and wearing the extra, layer of the paper.
Yeah.
Then you had to put on another gown and put on your face shield to go into the room. And you could be in the room, anywhere between 2 minutes to take the vitals or half hour or an hour, because we also had to help clean the patients, turn them and stuff throughout the night. It was horrible. It was fucking horrible. And for those, just for anybody, the hardest part for me to get through is one of our patients, a couple of our patients died, but the one that when I was there that night, he died.
Wow.
At around 5 a.m. and there was nobody there to say goodbye. There was nobody there to hold his hand as he took his last breath, nothing. And we had to just body bag him and transport him down to the morgue downstairs.
Wow. So a very tough part of it was actually being there while someone passed away and seeing the fact that they had no loved ones around them.
Nope. And because of the craziness, they wouldn't even let you in.
Yeah.
As a family member or as a loved one.
Yeah, that's crazy. And to have no one around you and knowing that there are loved ones that really want to come see you, but they can't. That's something that a lot of people don't think about, but it's tough. I've had some people close to me in which a father and sister passed away from COVID-19 within 1 week of one another, and there was no array. Yeah, it's been a crazy thing.
Yeah, it's even crazier, because you don't have time to mourn them. If one of your family members or you're ill for a while and you kind of see it coming, you have time to kind of preparing and all, physically, emotionally, financially, all that stuff. This just came and got you. There is no time to grieve in a sense.
Yeah.
That quick.
That's exactly. So then you're in Atlanta.
So
there's a whole nother situation going on with the protests. How are you seeing that happen on the ground?
Well, I actually got here late a couple of nights ago when people were protesting at the Wendy's and set it on fire. But I don't think that's close to where I'm staying. I'm staying somewhat close to the airport, so it's further south from the actual city. So I haven't really seen too much. I've been stuck at home. I understand when people want to go out and do things, but there are certain things that I just don't feel the need to do. I don't have to go eat at a restaurant and sit in the restaurant while I have my I don't have to go to a bar, sit at a bar or a club and have a drink with people and be around a bunch of people. I don't feel the need to go to the beach. I was at the beach, in Jacksonville, but I stayed away from people.
Yeah.
I just don't feel those needs. It's not a need, and I'm not going to do it. And there's still a chance that I'll contract it again. But I'm not going to put myself.
You're a COVID survivor, and you don't want to go through that again.
I'm not willingly. I'm not going to. Like I said, I'm not going to go out to these restaurants, and sit in a crowded restaurant when I don't have to. I will put my mask on, an N95. Will put my mask on, go in and get my food, and get the hell out.
I went to pick up a slice of pizza for my father the other day.
Mm-hmm.
I was the only person, other than the employees that worked there, that was wearing a mask. I did not understand.
Yeah.
How is it that people really think that this is 100% over? And a lot of people really believe that this is something that was taken out of control. They're blowing it out of proportion. And you can believe that until you...
And I have to say, I agree with that to an extent. Absolutely. But you also have to realize this is not the flu, or this is not a disease process that we've known about for years. We have research and we have these protocols set in place. This is new for everyone. It was something that unfortunately happened the way it happened because it was a new disease process. Yeah, and it sucks, but that's just the way it is. We don't know anything about it. We're still learning, and they'll put out a piece of information today and then 2 weeks they'll be like, oh, we were wrong about that. This is what it is now.
Let me ask you this.
So then go ahead.
Are you married, in a relationship, dating, wanting to date? How is that working?
First of all, how dare you?
Well, the reason why I ask is because it's pretty crazy for single people this time. Don't get it twisted. Because this is going around doesn't change the fact that people need companionship and relationships. Yeah. So how is it trying to have a relationship with somebody as a single person? As a married person, you stuck. That's often how marriage feels. Like
it depends on your marriage and the parameters of your marriage. Because there's marriages there's an open marriage. Or there's a triad, whatever, all these different terms.
Are you in an open marriage?
I don't know. Whoa. I'm not married. As I'm sure people who listen to this may probably deduce, I am gay.
Oh, holla, that's what's up for you.
I'm in a long-distance relationship.
Oh, okay. So you guys are social distancing regardless.
We don't have a choice. We don't have a choice. So I actually haven't had any physical contact in a romantic way with anybody since I met him.
There you go. You better stick to your story. Ago. You better stick to your story on that one.
And I get that it's hard. Just like with the whole having to go out to eat and socialize, and drink with people. I get that it's hard to do those things. But when you think of the alternative, it's like, is it really that important? And so that's a personal question that each person has to kind of wrestle with on their own and come to a solution on their own. Unfortunately, in the gay community, there's a lot of hooking up. There's a lot of sex going on. Okay?
Yes, it's very promiscuous lifestyle.
Well, it's like that in the straight community too, but I think it gets highlighted in the gay community a lot for some reason, which is a whole other podcast. I've talked to friends that are they're not necessarily hooking up as much maybe, but they're still doing what they do. And I'm like, really? You can't for a while? Really? Okay. Those are their choices. But me, I have...
Listen, just because you're supposed to be social distancing doesn't mean you lose that horny feeling. You still want to... companionship.
Yeah, we're still human beings. We have needs in general, whether they're sexual, whether they're, again, you happen to be social, you haven't seen. Listen, I spent, I don't know, like a month and a half. I don't even remember without touching anybody, without hugging anybody. And I'm a big hugger. And when I finally got to hug one of my coworkers, after weeks and weeks, you feel we have needs as human beings. I get that. But what is the end result?
Is it worth
possibly?
It?
Exactly.
Yeah.
And again, that's a personal.
Yeah. Well, if more people thought about that, maybe we would have less issues. If more people just took into consideration, listen, if I stay away from those that I care about and just stay out of the public for a while, maybe this will just blow
Yeah.
over quicker. But everyone has ran out to the beaches,
Right.
ran to the clubs. People are having parties at their house. Then next you know, you hear that how much this shit has hit the fan. You know, it's crazy.
Yeah, and then on top of that, you have to. People don't think about the cost that you're putting on somebody else.
Yep.
We as healthcare professionals, I'm sorry to say this, but I did not sign up to take care of people at the expense of my life.
Yeah.
That's not what I signed up for.
And that's what they
And
say
I
you're a
did
hero.
it because I had it's a whole other topic. I did it. I hate people referring to somebody as that's a whole really I'm a hero because shut up. Anyway, I did it for an extra 6 weeks because I didn't want to put the extra burden on my coworkers having to cover a shift for 6 weeks when we're already shorthanded and we're going through a crisis. So I did it. When I went back for the week, I kind of, in a sense, knew what I was signing up for. But prior to that, I didn't know. None of us knew that we were signing up for this crap. And for you as a person to willingly go out and put yourself at risk and at danger to contract this disease, and for it to do what it possibly does to you, and then it's devastating our healthcare system in ways that it has never before, the disease process hasn't before, that's a little selfish to me. So that's the whole other side of the coin that has to be addressed. Unfortunately, people just don't care. And if you don't care
That's the
that
unfortunate
you're possibly
reality.
going to be, that you're going to be, having to go into the hospital and exposing whoever's taking care of you, doctors to nurses to techs to just whoever.
Not just that. It goes farther. So my mother-in-law survived cancer, and she lives in another state. My wife wants to go see her mother, and because of the fact that how the numbers are rising out here, you can't. And then when she does go out there, she's actually going to have to take a time in which they may see each other, but they still have to stay away from each other just to make sure. Grace period to make sure.
It's just not the same.
Yeah.
Yep. I had a friend, one of my coworkers, who I think is about 30, 31, 32, just had a baby. She still hasn't seen the baby, I don't think. And she had the baby like 2.5 months ago.
Wow.
And they don't, they live in the same area, and they still haven't seen the baby.
She hasn't seen her own baby, or her family hasn't seen the baby?
No. My friend hasn't seen her niece's baby.
Oh yeah, if you want to see that baby get to 5 or 6, stay away. Stay away. You're protecting
just
others
craziness.
by staying away.
Yeah,
Well,
basically. And a lot of it is self-awareness and making your decisions. But you also have to realize that those decisions are not just going to affect you.
yeah.
These doctors and nurses that are putting their stuff in. And it's also, when I was still in New York and I was seeing pictures of people going to the beach in large numbers a couple of weeks ago, Florida, California, and other areas. And I'm like, that to me, that's just such a slap in the face to the healthcare workers who are on the front lines right now, because what's the point of me doing this? If you're just going to go out there and willingly put yourself at risk in this manner, what's the point? Why am I even doing this? What's the fucking point? For what?
It's the truth. Listen, man, D, I'm going to have to say I really appreciate you sharing what you're going through, sharing your story. It's been an absolute pleasure. Wishing you the best. You're a COVID survivor. Surviving.
So far, yeah.
Yeah, exactly. You're going through all the protests out there in Atlanta, bobbing and weaving, trying to stay from getting arrested.
Yeah, protests everywhere, and the whole other podcast.
Yeah, but I appreciate
I've been clapping back nonstop.
Sometimes you got to, man. You got to. But I appreciate you calling in, talking sweet with Sweet Baby J, and to you and anyone else out there that would ever like to have.
I cannot with you.
Yeah, that's me, man. Talking sweet with Sweet Baby J.
I cannot with you that name. Where in the hell did that name come from?
Sweet Baby J? No, not too many people ask that question. Well, I'll tell you. Anytime when you go to a restaurant and they ask you for your name.
As a foodie, yes, I know.
There you go. My name is actually Jay. So I always tell them my name is Sweet Baby J. And the reason why I say that is because when you're giving that name to a guy, they never want to scream out Sweet Baby J. They will rather come over to you and whisper.
Depends on the guy. So that's what you give to people at the now problematic Starbucks?
To every place where I go, I tell them my name is Sweet Baby J. Ladies love screaming it out for some reason.
Oh, I wonder why.
Well, hey, I am what I am.
I'm going to tell your wife.
She knows.
You are problematic. I cannot with you.
She's the original sampler of the good.
Oh, Jesus. Okay, I'm going to leave that alone.
There you go, brother. Thanks for calling in.
As an almost married man, I'm going to leave that alone.
There you go. Thanks for calling in with Talking Sweet. You're talking with Sweet Baby J, and I appreciate you. If you ever want to have your anonymous interview on any topic, because nothing's off the table when Talking Sweet, call in at 669-241-1422. I appreciate you.
All right, man. Call me.
Have a good one.
Likewise, thanks for the interview, and take care of yourself, man.
You too.